start. And even if we have to bring it forward for Armand's session, because he's got to leave by no later than, I think, 11:45. Okay, so we'll get on. Yes, it's recorded, and we all know that we're in step 4 now. So we're waiting to hear more information about what the implications are going to be. ACRE still has not updated the information sheet. I know they're working on that currently, so that will be version number 11, and all the accompanying appendices have to be updated as well. So I think it is quite a lot of work to get through, and they're very, very conscious that village halls across the country are so anxious to get hold of this, and they have said that hopefully it will be, later this week, but fingers crossed, we'll see when that comes out. Next slide, Sky. So we'll go through the agenda, what we're meant to be doing this morning. So it's, I can get mine to come up. We've made it, we said a little bit shorter this session, but we are happier to carry on up till 12 o'clock if people want to ask more questions. But we said till about 11:30, because it's not so much to talk about as regards regulations, apart from that they've all been lifted. So if you do want to talk longer than that, we're quite happy to do that. So we're going to talk about step 4, lifting of the restrictions overview, because as I said, we've not heard yet from ACRE all of the full response to that. And then Armand Williams has kindly offered to join us from the Derbyshire Public Health Emergency Response Team to talk briefly about the work that they are very, very busily doing in response to the test and trace and tracking of cases and that sort of thing. We'll have a short coffee break, and then we're going to do it slightly different this time, but rather than just talking through slides in the second half, we'd quite like to hear about what your concerns, worries are now that step 4 has started. So we're going to have like a discussion, an open forum discussion, and you can talk about what's the main worries that you've got. And then we'll just finish off with a few points at the end. So change of focus now, we're into, they're talking about treating corona a bit like the new flu. You know, we've got to live with it, basically. Pathway through the summer, this is sort of basically the information that the government are coming out with. It's very, very much a change in focus now. I think they're expecting that cases are going to go up. That's inevitable. There are risks as the cases rise. I think it's about 50,000 every day new cases. But I think during the summer, by the end of the summer, they're anticipating possibly the peak. I'm sure you've listened to the news regularly and know what the government are expecting cases to increase, with an anticipated peak by about 200,000 daily cases by the end of this year. So I think what that indicates is that what's happening now with the opening at step 4, things still may change. We do not know. This is not definitive what's going to happen long term. So it just depends what's going to happen by the end and the peak of this 3rd wave. Obviously, there's the fire break of the school holidays, which will help a little bit. And things may change a little bit when kids go back to school in September. So what we've been the legislation that we've been living under for the last year or so has been the coronavirus health protection regulations, which have now been lifted. And it's sort of almost reverting back to the health regulations that were in place before the Coronavirus Act. So most of those regulations have been revoked. But there is 1 or 2 little caveats to that, which I will mention, that might affect how you manage your village halls. But it's very, very much cautious approach. Gradually is the key message that's coming from the government. The shift is from response to recovery. So that's going to be a slow process and take it step by step. And as Jonathan Van Tam said on the telly on Money, don't burn the pants out of this, meaning we don't expect people to just go mad and get back to normal as though nothing's happened. he's saying it is far from over, and I think we're all aware that that's the case. So we've seen this slide before if you've joined in previous sessions. Step 4, all of these things that were anticipated to be lifted have been lifted. And as I say, there's a few caveats I will talk about. They say subject to review, but obviously that review took place on the 12th of July and it was announced that they would all be lifted. So I think we're quite familiar with that slide if you've been on previous sessions. So we know that there is the end to social distancing, and now that difficult thing we had to come to terms with about capacity limits at events and trying to work out how many people were allowed in various size rooms and venues. That has all gone, hopefully. So as now all adults have been offered the chance to take up the vaccination, that is why the government were enabled to go ahead with step 4 on July the 19th. And again, as Jonathan Lantam said on Monday, just because you can doesn't necessarily mean that you should. So I think it is still very much down to discretion of the managers of village halls, how they want to proceed. It's not prescriptive. You've got the power and the authority to make decisions for what happens within your own particular organisation. And also for groups as well, just because they can now sing and dance and, hug each other, it doesn't mean necessarily that they should. So being very cautious with the groups and also with how you're managing the hall. Right, next slide. When I talked about that there are...
is this the correct slide, Helena? Sorry to put in, or is
no,
it...
we're on to 5. I'm just trying to go through quite quickly now to catch up on that time.
This slide?
Next one. Yep, thanks, Sky.
No problem.
Does that come up? Right, okay. Yeah, so all restrictions have been lifted, but what the government are allowing the local authorities to do is that they had powers during COVID to close premises. So local authorities, if they felt that an organisation, a hall, whatever, was not following the COVID regulations, they had the power, which was given to them during that period, to close halls and venues at their discretion if they felt that that was necessary. And that power has been continued. So even though step 4 says that all the restrictions have gone, that power still remains in place up to the 27th of September currently. So it's giving them a little bit of flexibility, a little bit of leeway, that if cases continue to rise in some areas and not in other areas, a bit like when it was the tier systems and there was, local restrictions. So that would give local authorities, if there are high cases in particular areas, it gives them the power to close down venues and other powers as well. So it is still very possible for local authorities to enforce the closure of halls. We don't anticipate that, but it's something that they're to be aware of. And I think the other caveats which don't affect village halls, social distancing still remains a requirement if you are coming back into the country or travellers from abroad, and before they pass through border control, then those social distancing regulations still apply. And I believe hospitals and care homes can use it for infection control as well. So, it's not like all of the COVID restrictions have been lifted. Right. So again, when we're talking about local authorities and what their powers are, they're going to be looking very, very closely how people are going to behave. And I always advise that if you are planning to have some sort of event or outdoor large event like a fete, concert over the summer months, I think it's a good idea to contact the local authority and just talk through your safety measures so that they're aware of what's going on and you've asked for their advice as well. I'm sure they much prefer that you do that rather than, it's reported and things get out of hand. So do make use of the local authority as an aid rather than somebody who's just there to be, monitor and police events. Next slide, please, Sky. So lifting of restrictions, people are asked to make informed decisions and act carefully and proportionately to manage risk to themselves and others. So again, the focus is very much back on individuals and organisations rather than regulation. So while the legal restrictions no longer apply, so you're not going to necessarily get fined under the COVID regulations, the government said that they are still going to continue issuing guidance as we go through the summer and in response to any changing circumstances. So I think it's a cautious approach, and I think we're all going to be aware that things can still change. It's like a step by step as we come, as we've now got that authority to take decisions ourselves. I think there's a positive to this in the fact that halls and organisations can't be fined for breaking the regulations. But the negative side, it's harder to manage and to control events and activities safely, because it's literally down to your discretion what you think is safe and what isn't safe. So it's prescriptive. Rather than being prescriptive, it's more interpretive and use your own discretion. Next slide, Sky. So social distancing. I've put these in visual things really so that it's just a good quick overview to skim over. And I think you're probably all aware, as the regulations have been lifted, that means now end to rule of 6 and the 2 households and bubbles indoors and the number outdoors, that's all gone. What they're advising though, it's still better to hold smaller events whenever possible, being aware that social distancing, social contact is a risk still. Just be aware of, if you can have smaller events, it's better than having large events straight away. Still consider that risk of close contact. And also you've still got to be aware that some of your users and people attending could be clinically vulnerable or clinically extremely vulnerable. So it's all right thinking, yes, you've got this crowd of people, they're fine. If you don't quite know. So I think it's good to have some sort of system whereby the hirer knows if they've got anybody attending their event that's in that category, then they can make special arrangements for them to be kept slightly distanced from the general group of people. And of course, not everybody's been fully vaccinated yet. So that's another thing to be aware of. We're not 100% adults vaccinated. I think the government, I don't know if they've issued, but I think there's going to be some extra guidance for how to handle clinically extremely vulnerable people attending events. But the last I knew, I've not seen that guidance, but I think there will be some guidance coming on how to manage and handle that. The other thing that's gone with social contact is that in hospitality venues, table service restrictions, that's gone now. You don't have to be sat down to have drinks and food, and the distance between the tables, that has now been lifted and gone. So I think that's quite straightforward on that one. So the next one, Sky, face coverings. It says it is expected and recommended that people wear face coverings in crowded areas such as public transport and shops. And it doesn't say that, but I think they're recommending probably in shops. It's a good idea. Again, that is up to the trustees, event organisers and the attendees themselves to decide. You can advise, you can recommend, but there's no law enforcement with that. But remember that it is a respiratory disease. So again, you might want to limit or avoid having very crowded, very big events. consider the number of attendees, size of the room, what ventilation there is. And if you can have events outside, that's what a lot of the recommendation is over the summer months. As much as you can do outside, still do that outside. Which, you know, that will work for some events, but not all. Okay, I think in your hall, it's still advisable if people don't want to wear masks. I think if you can still advise them in confined spaces in the hall, such as if you're people going to the toilets, kitchens and corridors, or if it's a very crowded event, it could be good to say, well, we would like you to wear a mask. And even if you get, you know, 60, 70% adhering to that, that's better than nobody, helping with reducing that risk. Well, we can talk about that when we have our discussion later on after coffee. So the next slide, Sky, capacity limits at events is lifted. So all that working out, your capacity limits inside and outside is gone. And when there was limits for weddings and funerals, for wakes and ceremonies, that's all been lifted. But what they're saying, it's still advisable to keep testing regularly to help manage your personal risk and to protect others. See what that says. I'm reading quickly through my notes. I'm skimming through them to see if there's anything there that's new and different to say. And as we have said, that local authorities have got the power to close venues hosting large events. You know, if you're holding an event like a music festival or a carnival, do be aware that it's not just, you know, free range. Basically, the local authority will be watching it quite closely. And different districts will interpret this and use their powers in different ways. So what might be acceptable in one district by one local authority, in the neighbouring district, they may consider that to be unacceptable. So there's going to be a variation across within Derbyshire and across the country. So we just have to go by what our particular local authority sees to be appropriate and what's going to be what they see as safe. I think I'm going to pause now because I'm looking at the time. And there's just a few more slides I can do after when we talk about the emergency response team. Are you okay now to, Armand, if you do your section now, will that give you time?
Yeah, that's fine, great, thank you.
Okay, well, I'm going to pass this now to Armand because I know he's got another meeting to get to, and I do not want him to, I don't want us to cause him being late for that next session. So if Sky can get those.
Armin, if you want me to share the slides, I should be able to let you click through them.
Okay, that's great, thanks.
Give me 2 seconds.
So Armand's from the outbreak management team for the Derbyshire County Council, I believe, and I think they've been extremely busy.
Yes, somewhat.
Thank
you. Yeah,
you.
that's great, thanks.
There you go. You should be able to click onto the next slide. If not, just ask me and I can do it. Oh yeah, I can see your mouse on my screen.
Oh yeah, cool. Okay. Yeah, hi. Yeah, so my name's Armand Williams. I'm one of the service development officers for the local outbreak response team in Derbyshire Public Health, which is in Derbyshire County Council. So just going to give you a little overview of what we do within the team and kind of the things we've been doing over the last sort of year and a half, and a couple of things that are sort of important at the moment with stage 4 opening up. Oh, I can't seem to change the slide though.
Oh, I'll do it. It's fine. It's fine. If you
Thanks.
start moving your mouse, 2 seconds.
Next slide, please.
Sorry. There you go.
No, that's all right. It's weird. I can see the cursor moving, but I couldn't see the. Okay, yeah, so we work according to the Derbyshire Local Outbreak Plan. So that's the local public health plan derived from all the national legislation and Public Health England. So the aim of those throughout the whole pandemic has been to prevent the spread of COVID-19, contain and suppress the outbreaks, which I'll mention a little bit more about later, early identification and proactive management of outbreaks and incidents, and effective communication with the public and stakeholders. The other little bit there is just the test and trace and self-isolation things which we're all aware of now. Next slide, please. There you go. So the outcomes we work towards is to help protect the health of the population of Derbyshire County from the risks associated with COVID-19. So the key elements of this is to support key settings such as schools, workplaces and residential care in order to contain and suppress outbreaks, which is by far the majority of the work that the team has been involved in. Engaging with highest risk communities to support individuals to understand the key government messages around COVID-19 and to raise awareness of support available for those affected directly or indirectly from COVID-19. Next slide, please. Thank you. So who we are. There's 4 service managers that help to cover the three main settings that we work with, workplaces, schools and residential care. So some of these service managers are very experienced environmental health officers or people who have a lot of experience in public health locally and regionally. Also have 9 service development officers, myself being one of them. So we help with monitoring particular localities. So I work in Amber Valley and help specifically with the Amber Valley elements of the team, but also work with workplaces. So those 9 service development officers are spread around the sort of key areas that we work in. And in the wider team, there's also 20 contact tracers who support the National Test and Trace programme, calling individuals who have tested positive for COVID-19 and getting the details of the contacts and all that information. In fact, we're recruiting, we've just recruited more contact tracers. So I think there's going to be 28 contact tracers from now on, because there's going to be more of an onus on the local contact tracers rather than the national team. So I think over the weekend, it was something like 500 calls a day coming in that were needing to be allocated to the contact tracers to make those calls. So it's been very, very busy at the moment. Next slide, please. Thank you. Yes, so the way in which we work is we work by using non-pharmaceutical interventions for COVID, such as engagement, working with partners, understanding why local areas may have higher cases. So we see all the data, we have some local knowledge, we work with local groups and local projects, and we try and find out why there might be a peak in a particular area, in a particular locality, in a particular workplace, in a particular school, and trying to figure out why that outbreak is occurring so that we can suppress the outbreak and bring it back under control, prevent it from spreading into the wider community. To do this, we support the IMT, which is the Incident Management Team, which exists as an IMT for each area. So I go along to the Amber Valley IMT, where we look at the current data regarding COVID at a district level, and care homes, workplaces and schools, etc. Then when an outbreak is declared, it moves to the OCT meetings for that locality as well. And that's where specific discussions happen about that particular outbreak with environmental health officers, with the police, with the council's communications team, or anyone else who is pertinent for that particular outbreak. We also cover the test and trace inbox, which is, to be honest, a massive amount of our work. So any notifications of any cases at workplaces, schools or care homes comes into the inbox, either directly from those settings or from Public Health England. So at the moment, it's just been absolutely crazy with schools reporting cases, schools reporting multiple cases in a day even as well. So it's been a lot of fun. And then we also attend national briefings and meetings for mutual learning and to enhance the work of the team as well. Next slide, please. So yes, one of the key stages at the moment, the COVID restrictions being lifted this week. So as Helena mentioned as well, so most legal restrictions to control COVID-19 have been lifted this week. But in order to help minimise the risk at a time of high prevalence, we advise, and the government still advises this, Public Health England still advises this, and Derbyshire Public Health and Derbyshire County Council still advises that we all should limit the close contact we have with people outside of those we live with, and increase close contact gradually. Meet outdoors if possible, and still have those behaviour patterns to help minimise the potential spread of COVID and the impact it'll have on us and the community. Requirement to wear face masks has been lifted, but again, recommendations to use them and wear them in public places, in crowded areas and on public transport. And there's no longer a limit on the number of people who can attend weddings and events. And just to touch a bit further on that, with regard to village halls and community venues, I completely appreciate it's been a very, very difficult year and a half for community venues. In my previous jobs, I used to do a lot of community development work, well, actually down in Bristol. So I worked a lot with community venues. And while community venues, there's a massive need for that income from groups and activities and events taking place. It's finding that balance between those audiences, whether it's on the one hand, it's an exercise group for most adults, or if it's a group for older people and more vulnerable people. So it's getting that right balance, but it's having those policies and procedures in place to ensure that a venue is COVID free and COVID safe. So as Helena also mentioned, that the legislation and enforcement has changed, has gone away. But what that does mean is that the COVID risk assessments still exist. It's still the best thing to do is do a COVID risk assessment on a venue or any activity that might be taking place. And that instead of it being specific as it has been over the last year and a half, it's just going to be sort of moved more into the general health and safety behaviour and policy and procedures for venues. So the onus is going to be back on the business to include COVID-19 safety and safeguarding within the normal health and safety procedures for the venue. Next slide, please. Thank you. And just to highlight really the last thing on this presentation, some of you might already know of this, but there's a COVID Community Response Fund, which was established by the County Council last year to help support voluntary and community sector organisations and groups in improving the health and well-being of the residents of Derbyshire during the pandemic. Constituted organisations and groups can apply for up to £2,000, and non-constituted organisations and groups can apply up to £250. Now, this fund is going to be continuing for another year. There is a slight review at the moment, as a slight change, some changes needing to be made to the application forms. But if anybody is interested, then please contact this email address here. And once the new forms are ready in the next couple of weeks, we can send them out and start the process. If a group or organisation has already applied successfully for this fund, then it has to be a different project. It cannot be a continuation. The second funding can't be a continuation. But if you just contact and have a discussion, then you can see if any project or idea or initiative would suit this fund, and can help in supporting the community venues and the communities further. And I think that's it. I think the next slide is the any questions slide. So any questions?
It's really useful to know about that COVID community response fund, Armin. So presumably, if halls have got a project, they have to be health related. So so is that like social isolation? Could that be covered as getting people together for a coffee morning, or getting people out of their homes and socialising? Is that classed as a health?
Yes, yeah. I've only just become involved in the fund. The first meeting I attended about it was on Monday, so I'm still learning about it myself. But if I remember correctly, then yes, it's about the wider direct and indirect implications on health that COVID has brought. But previously, in the last year, the kinds of things that fund has helped to fund has been the face mask screens, any equipment that's required to help with creating a COVID safe environment. It also has bought I can't think of the examples at the moment. The best thing to do is, if anyone's got an idea, then to contact that email address and just have a quick chat with myself or one of the other service development officers, just to see if an idea does fit the fund or not.
I think we've got a question from Kim.
Hello, good morning. Yes, thank you. I suspect we'll probably get into this later when we're all talking about the different measures that we're keeping. But I just wanted your advice, really, as a sort of professional, if that's possible. I don't know if you're able to give me advice on that, but we've decided as a venue to continue to limit numbers at the moment. We didn't feel, and our caretaking team didn't feel that they felt safe in allowing us to be absolutely packed to the rafters with things like salsa parties and things like that. I just wondered if that would be your recommendation, that, as you've already said, it's up to us to risk assess it. We've risk assessed it, and we feel that limiting numbers is a sensible thing to continue to do. Is that something you would be supportive of?
Yes, absolutely. It is a very difficult call. From one hand, with the income that's required, or a lot of community venues rely on, the staff and the people involved in the community venue and how they feel about capacity. So it is a very difficult one, but yes, I would recommend that we, just in general, keep the same behaviour patterns as we have done over the last year. Certainly for the next few months, just to see how things go. Hopefully the vaccination programme, when it reaches sort of 80% double vaccinated and things like that, then it'll have a far bigger benefit than it even has so far. But just to give that bit of time, I keep with the COVID safe practices for now.
Thank you. Yeah, I mean, we have increased them a bit. We've doubled what we're allowing for 2 metre distancing, but that's really reassuring, because 99% of our groups that we've spoken to have been fully supportive of that measure, but just 1 or 2 have really pushed us on it. But I feel like I need to stick to my guns. So thank you very much. That's very helpful.
Anne, did you have a question as well? I saw you raise your hand earlier.
There's a question in chat from Janet.
Let's deal with that one first, because it may be connected. Part of what's just been said was some of what I wanted to say, so I'm okay at the moment.
Okay.
So Janet said, if we get a COVID case, would we be closed down for a period? Should we close down for a period?
Not really. I mean, it's a difficult one, because if a particular venue has a couple of cases, it doesn't necessarily mean that those cases caught COVID or COVID was transmitted at that venue. So, for example, when we look at some workplaces like a factory, a warehouse, there's one recently with about 15 cases. It was a very, very big warehouse, lots of social distancing, lots of COVID safe measures, HSC inspected as well. So the COVID safe measures were definitely really good, but yet they had 15 cases. Just looking at that as a data, you assume that it was because of the actual warehouse itself, so that would be shut down and things like that. But as it turns out, they all caught it while they were watching football in the pub. So it's that intelligence, that data that does make a difference. So if it's one case, even if it's a couple of cases, it doesn't necessarily mean anything. If the suspicion is that they caught COVID in the actual venue, then the first stage would be to look at how that might have happened, what improvements can be made to either the cleaning, social distancing, or shields. I can't think of the word. Those kind of COVID safe measures. If there was a big outbreak, we're talking about a lot of numbers, really, anything more than sort of 5, 6. That's when it really starts to trigger a more in-depth look at a particular venue. No, I can't think of any community venue that's come up or flagged up on our system, although, to be fair, they've mostly been closed over the last year and a half. But yeah, well, 1 or 2 cases I wouldn't necessarily worry about. We get the data coming through to us, so if anything does flag up to us, then I'm sure we'll be in touch if there was anything to discuss at that stage.
And there's a question from Seidel. Do you involve the district councils in the response meetings? Can I share the funding link on the NEDDC website, please?
Sorry, that's
yes,
Derbyshire District Council, sorry.
That's all right.
Yeah, we do. The district councils are involved in the IMT meetings, which discusses the sort of general state of play at that present. So, for example, the reason I have to dash in a minute is I have the Amber Valley IMT at 11. So at that meeting, it has the environmental health officer from Amber Valley who works for Amber Valley Borough Council. So there's a direct link into the Borough Council there, as well as other potential links as well. We have the police coming along, we have the fire service coming along, all sorts of people, NHS, and we all discuss, look at the current cases, comparing the last week with the last 2 weeks, the breakdown according to age groups, breakdown according to postcode and MSOA areas. So the locality areas, sort of say 10,000 odd households in an MSOA area. So we look at all that data, we look at the data for all the care homes and workplaces and things. So we're working in a multi-agency team to do that. With the information about the funding, I believe that there is going to be a new sort of communications campaign in the next few weeks promoting the fund again, because it's only recently been decided that it's going to continue for another year. So at the moment, I'd say if you could hold off necessarily, I mean, it's fine to sort of mention it to people and mention it to groups and community venues for now, but I think anything further publicity-wise, I would suggest not at the moment until the official sort of publicity lines of communications are developed, if that's all right.
Brilliant, thank you.
And there's just a couple more questions in the chat. If a venue has a reported case, is a deep clean recommended?
If it's only one reported case, then it's not necessarily. It is up to you. I mean, the general guidance that we've been giving out to people, if it's 1 or 2 cases, then it's not necessarily required. If it's more than that, then it would be a good idea to do, especially if the transmission was identified as occurring in the community venue. But if it's just 1 case, then I wouldn't necessarily panic too much about deep clean. But in saying that, what I would suggest is if you had a big event one day with a lot of people attending, a one-off event, say, then a deep clean might be a good idea after that, before regular events sort of come in days after that. So it's just it's looking at it on a case by case basis, the amount of people involved, the timings between groups, the capacity and the ability to clean as well, or the frequency of cleaning. Yeah.
It's very much now down onto individual organisations to make these judgments, isn't it? And it's rather than being prescriptive, you've got to do this, you've got to do the other. It's because every individual venue is different. The size, the location, the size of the group that's using it, they're all different. So it can't be one rule fits all. You've got to use your judgment, what's practicable, what's, you know, what you feel is safe. But I don't think it's a case of being too panicky and too worrying about it. It's just being reasonable and look at it, as you've already said, about it's normal now, health and safety. This has got to be the norm moving forward, and COVID is going to be treated like just every other health and safety issue within your venue. But it's
absolutely.
Yeah, that mind shift.
And there's just one last question in the chat, and it says, do you need a COVID risk assessment for outdoor events?
I think that will still be required.
I would think so.
Yeah.
You'd be doing a risk assessment anyway, wouldn't you? You've got to do a risk assessment any event. So like we've just said, you're doing a risk assessment for that event. You've just got to now factor in COVID. Sorry to butt in there, Armon. But
no, it's fine. Yeah.
That's what ACRE would say, I'm sure, on that one. Well,
are there any other questions for Armon at all? Anne?
Yeah, I did send it, but I sent it direct to you, Helena. That was, is it still advisable that we ask people to keep lists of people attending meetings and or using the app?
Sorry, I missed the start of that. So should people still be using the app?
Sorry, if you've not, it's either use the QR code, and people that don't have the QR facility, halls have to keep names of all the contacts of people that attend. So
this is this is an interesting one. The communication from the government has not been our friend, shall we say. What we would recommend is that venues would still use the QR codes and encourage as much as possible all the people who attend, or all the patrons, all the customers, to keep using the NHS the COVID app, and to use the QR codes with the app, and just encourage that as much as possible. It's just very, very difficult to do that when the idea of Freedom Day has sort of put a spanner in that works, and the government communication and messaging hasn't really been that clear. But yes, definitely recommend still use QR codes, and recommend that all people use them and keep using the app.
And I would recommend they still keep lists as well, the people that haven't, just it's common sense to do that. And as managers of the venue, you've got that discretion now to insist that your users do that, or ask them to do that. You can't enforce it, but you can ask them to do that. It's your power to do that, rather than the government asking. So okay, Armon, I know you've got another meeting, and I'm very conscious that I don't want to run into your next meeting. So thank you so much for joining us. I know how busy you are, and it's been a really, really hectic time. But I'd like to say thank you on behalf of everybody that you've had, given us this time.
Yes, thank you.
Really appreciate it.
Thank you.
Thank you.
Thank you for joining. Thank you.
Ta-ra. Good luck with everything.
Very much.
Thank you. Bye.
Ta-ra.
Okay. What we'll do, Scan, I'll just run through the last couple of slides before we have a short break.
Yeah.
So on slide 11, I think now.
This one?
The next one down, it's the pinky one.
This one?
Yes, that's the pinky one. Yep.
There you go.
Just to really, this was the overview of what restrictions have been lifted. So there's just a couple more slides to finish this off before coffee break. one of the things that has been the hardest things for communities and families, and what I think we've all missed, is the chance to have family parties. I know we had weddings and funeral teas with limited people, but we couldn't have anniversaries, birthday parties, all those sort of things. That now can take place. So activities that many families have been missing, so that's private and family parties, can now take place. And the reason I'm saying that is because nightclubs are opening. Singing, dancing is now allowed. There's no limit on that, but with all those caveats, we need to be cautious. So smaller parties are preferable. Of course, there's no table service restrictions between tables. We know that as well for events where you're serving food. This will be really closely monitored. It's one of these things that has been lifted in other countries, and they've had to revert back. They've had to close it down. So I know things like nightclubs in, I think, the Netherlands, they were allowed to have nightclubs, and I think now they've realised that they're super spreaders, and they've closed that down again. So it's something to be aware of, that if you're having parties and things, just make those hirers aware to be extra careful if they can. Just be careful, you know, don't have loud singing, don't go mad, and you know, it's that spreading. What spreads the disease is it's aerosol, so singing loudly, shouting, that sort of thing. So just be aware. Next slide, please, Sky. And the last one, working from home. The government is now saying that no longer an instruction to work from home. So that may affect halls if they do offer some office space. You may have parish council staff or other type of office people working from your premises. And really what you've got to do is a risk assess the return to office working. There are examples of that on the government websites as well, but and the ACRE risk assessment, but there is one specifically for office workspace that you can find online. Again, like Armand's mentioned, keep staff safe, ventilation, screens, extra cleaning, etc., and make sure that the staff are aware of all those regulations, and be aware if anybody's clinically vulnerable. There's a lot of information now. Health and Safety Executive website, coronavirus working safely from protecting people. I can send that link, so if anybody wants that. It's good if you encourage all your staff to have vaccinations, and if not, lateral flow test, and to stay at home if they're feeling unwell. It's going to be a new way of working, as I've discovered coming into the office today after such a long time working from home. It's like an alien landscape with screens and everything. So if you've got office space, just be aware of that, which I'm sure you are fully aware. The next slide, Sky, please, is what we've just talked about with Arman. It's advisable to continue displaying your QR codes outside the venues, even though it's not a legal requirement, I don't think, on that. Get a test if advised to do so, and self-isolate if tested positive. That remains key to reducing the transmission. But I think it's a good idea still to take names of all attendees. I think people are fully aware about the test and trace regulations and when they've got to self-isolate, so that's all available online. We will have a coffee break now. We can make it a short 5 minutes if we don't want to over these slides. Yeah, I'm not going to read through this slide, it's a bit long-winded, but basically it's a reminder, you know, going back to the basics, which we mentioned earlier about risk assessments. Anybody with a control of a non-domestic premises, including the village hall, you've still got those legal responsibilities under health and safety law. So whether it's COVID or any other transmissible illness or any other issue to do with health and safety and fire safety, you know, you've got to go back to making sure that you incorporate the COVID issue and about the transmissibility and virus control into your normal everyday health and safety risk assessments. We will wait to see with ACRE on that, whether they're going to carry on using the appendices F and G, or whether they're going to revert it back to the generic risk assessment. But I would recommend carrying on using appendices F and G for now, or the updated one, if ACRE do update those. So that's just a reminder. It's back down onto basic health and safety. There's always loads of information on the HSE website to do with health and safety regulations, so it might be worth having a look on there if you want anything specific about cleaning certain areas, how to put safeguards in place. Also, when you're looking at your risk assessment, safeguarding is a big issue, and it's a legal requirement that everybody is aware of the safeguarding implications as well. We do have an information sheet on safeguarding, which you can purchase from RAD. We will be putting on training later on in the year, specifically to do with safeguarding in village halls. But again, that is another aspect of health and safety, so do be aware of that. Oh right, yes, I've got it in my notes here when I said about the bouncy castles. It's called the Showman's Guild of Great Britain, and they issue guidance on the safe use of bouncy castles. So I'm sure if you had one at a children's party or a fete or something, that the person that manages that bouncy castle would be abiding to those rules. But it's just worth being aware of the safety aspects when it's been the COVID and the transmission of the virus when kids are on the bouncy castles. Okay, well, that's just a reminder about the basics. And next slide, Sky, please, 16. I think we've talked about this, how you're going to go forward managing that risk at step 4, the basics, which we've said, ventilated areas, outdoors, if possible, open windows and doors, mentioned face coverings, especially when in contact with people you don't normally meet. Because if you're going to an event with your normal or family members, you don't have to necessarily all sit around with face coverings on. It's usually people you don't normally meet with, and you're in an enclosed or crowded space. It's advisable, and that's as much as the law is saying at the moment. Carrying on the good practice of washing hands with soap and water, I would suggest providing hand sanitizer and carry on probably into the future. I mean, I don't know whether your hall can cover the cost of that in the future, because it is an added cost to your running costs. But you know, there's flu, there's all sorts of other viruses around. It's almost become good practice. We're all used to doing it. I think if I was managing a hall, I would consider that we just carry on doing that. You might have to slightly look at your higher charges. It wouldn't be a huge amount, but it's good precaution moving forward. Then obviously covering your nose and mouth when anybody is coughing, sneezing. It's good to have a sign up about the catch it, bin it, kill it, or little stickers or something, so people are, you know, using tissues. Again, this is just good practice moving forward. The message about staying at home if unwell to reduce the risk of any transmission. They can then get tested and they'll know if they've got COVID or not. And we've said again, limit close contact with those you do not live with. And right at the beginning, and Armand mentioned this as well, increase contacts gradually. So we don't want to go bang into having big events, you know, full capacity. Just perhaps start with smaller events, and smaller events in a large room, you can maintain some sort of social distancing. And it's just common sense. I think the users would be quite happy if they were in a big room with a small number of people. They'd feel safer, especially the older vulnerable people. And obviously the frequency of contacts, proximity, how close you are, and the duration of those social contacts. Bear all of those in mind. And we've already mentioned consider others' clinical vulnerabilities and vaccination status, even though we can't do anything about that at the moment until we know what the law is going to say. So the next slide, please, is out of school settings. So this will affect halls if you have before school and after school events, wraparound childcare providers. This legislation is for school age children, and in schools no longer children are no longer required to operate in groups or bubbles, so that's all gone now. The face coverings are no longer required. What may have been affecting you as venues, there was a limit on the number of parents that could attend out of school events, but that's now lifted. So parents can come back and watch or be in attendance now. There's no limit on that at all. There's no restriction on residential stays. I don't know whether that affects any of you particularly, but some venues may have overnight accommodation or scout groups coming, camping, you know, scouts groups may want to camp outside. There's no limit now on the group sizes for any residential stay. And from August the 16th, which isn't that long away, children under the age of 18 years old will no longer be required to self-isolate if they are contacted by NHS test and trace as a close contact. So again, it's just indicating that it's a gradual easing of that requirement for under 18-year-olds. There's a couple of websites if you wanted to look more in detail about out of school settings. I've put the actual link in there, and then at the bottom I couldn't fit the link in, so you could just put Google in the Google search engine, actions for early years and childcare providers. Now all of these government guidance pages have been updated from the 19th of July. So if you previously looked at them and got the information, they've been updated since step 4 and the lifting of all restrictions. So if you're having any events, groups that involve children of either school age or early years and childcare age groups, then you can have a look. Until we get information from ACRE on that, and you need to find information, I would suggest you just look on those websites. Of course, it's the season for holiday clubs through the summer holidays. So that would come, the legislation, it's in the top one, the out of school settings guidance for holiday clubs, if you needed to look that up. Right, the next slide, please, Sky. It's only a few to go now. We've mentioned COVID certification. They will be required from the end of September to attend nightclubs and other venues where large crowds gather in England. It sounds like that's going to be very large events, but whether they decide to bring it down to maybe people of, you know, less than 500 people gathering together. So if you've got, say, a large venue, you might have a large number of people. It may affect. I can't see it coming into force for little family parties and small village events, but we don't know. We don't know if that's going to be changed. Also, I know there's been something going around. I know in Derbyshire, probably nationally, there's been a scam COVID passport text going round, and I think they're asking, it's saying you can buy a COVID passport, and obviously it's scam. So just be aware that, you know, I don't know how they're going to show that it's an authentic COVID pass when they come out, but there is already scams going around, and there's been one circulated in Derbyshire by text. When the NHS, there is the NHS COVID pass, which is on your phone when you've been double vaccinated, and that is free. So that's an app that you can get now if you're ever asked to prove that you've been double vaccinated. I've not done mine yet, I must admit. I need to suss out how to do this on the NHS COVID pass. but you may already have done it and know what to do. But just be aware that that might be something that a smaller evidence at a local level for small events, if it's something that people can show on their phone that they've had the 2 vaccinations, whether that will come into force, we've yet to find out. Okay, so the next slide is just to say, to make you aware that the Charity Commission guidance has also been updated. So over COVID and lockdowns, there's been lots and lots of issues to do with charities and organisations managing to have meetings and their AGMs. So information about that, I haven't read it, so I can't tell you what it is, but the information on the Charity Commission website has been updated about AGMs and meetings. And also it will explain about their new approach to the charity annual return. There's been an extension to the filing dates on charity meetings, and unfortunately some charities, because of COVID, will be in the situation of insolvency. So just to make you aware, that's been updated if you do need to find any information out about those issues. I can send you the link as well when we send the information out. Next slide, Sky. Just to remind you, if there's anybody who's not claimed for the Restart grant, which was available from 1st of April to cover the 3rd lockdown, the deadline is the 30th of July. So there is still time to apply if you haven't already done so. And if you're not sure, then contact me and I can put you in the right direction. We've been mentioning that at all the events, so hopefully everybody that's eligible should have got that by now. Next slide. We're coming to the end. There's just 1 or 2 bits I wanted to mention so that you're aware of what's available and deadlines and things like that. We've mentioned this before, that we're in the fortunate position that we were funded some support through Foundation Derbyshire to help village halls through the COVID crisis. And that comes to an end at the end of September. So we've been able to provide these Zoom sessions free of charge, and we've been answering a lot more inquiries, COVID related inquiries and the business support grants, those sort of things. But just to make you aware that we are still offering some free visits, on-site support to help your hall to reopen safely. So that would, if you've got any issue that is, preventing you opening safely, or you're not quite sure, or you want to have a chat about something, within reason, I should be able to come out. But as I say, time's getting limited now because it's the end of September, 2.5 months away, isn't it? So I would urge anybody who's got any issues just to fill in the Survey Monkey, put down what the issue is, or just a generic, you would like a generic visit, then I'd urge you to do that, because we're very happy to come out and visit and help where we can. After September, that offer will not be there. We won't have the fund, the funding will be finished and it will be reverting back to our normal service. So do make the most of it while it is there. I'm very happy to help where I can. So yeah, coming to the end. I'm just mentioning this again about safeguarding. We're also, alongside other projects, we're running a safeguarding project, which is a national acre project. And the aim of that is to inform as many village halls across the country about their safeguarding responsibilities. There is an acre information sheet which has been updated a couple of months ago, and we will be running a training event later in the year. But if you're not sure about it, or you want any queries about safeguarding, look on our website. There are lots of links to resources and what's happening in Derbyshire. Excuse me, that phone's good. Oops. Hello, I'm on a Zoom call. Can I phone you back, please? Sorry about that. I don't know how to switch that phone off. Okay. Any final questions before we finish? The last slide. Q&As. Okay. I think it's been difficult to be specific at this training because we haven't got specific information to give you. I think the message is that it's handed over down now to individual people, individual groups and organisations to now navigate this themselves. I wouldn't panic. If you are panicking, we'll come out and help you navigate some of the issues. I think it is reassuring other trustees and other managers that this is doable. We don't know what's going to happen in the future. And if the local authorities or national government have to lock down or introduce new restrictions again, that's out of our control. So we can only go by what we're being told at this present time, which is be cautious, do it gradually, be sensible about it, but don't be afraid to do things and to open up. Okay, so thank you very much for joining us.
Thank you. It's been very useful.
Yeah, it has been really interesting. Thank you.
Thank you.
Well,